Hey docs, hope you're having a great week. This is a video about something where you're going to say, duh, I knew that, but I want you to really think about it just a little bit. And that is really that patients will not say yes to treatment that you don't recommend. And even further from that is they won't say yes to treatment if they will say yes to treatment even more if your team recommends it and you are the second opinion. But keep in mind that, our treatment planning is mission critical to our outcomes. Treatment planning is obviously a very critical lead measure to having patients be able to do treatment, move forward, say yes. So, continuing to work with your team to be comprehensive care providers is really important. Are we really evaluating soft tissue? Are we really evaluating hard tissue? Are we looking at alignment and occlusion? Are we looking at airway, if that's a thing for you? Are we looking at missing teeth? Are we seeing people with partials that could upgrade? Are we seeing people with, other areas of aesthetic concern that maybe they don't even know that a solution exists, all right? So if there's crowding, if there's misalignment, that's one thing. A lot of times they notice that. Other times they may not even realize, they could get their teeth 4 shades wider with just something so simple. Or maybe they want to get their teeth wider, but they've got some mismatch restorations and whatever else, and maybe crowns or veneers are the answer. And so a lot of times you just got to ask, hey, is there anything about the way your teeth are looking or the way that they're feeling or functioning that's been bothering you? Anything at all that you've noticed that you've just had questions about or maybe wanted to change? And then, make a recommendation. If you tell people, like in the urgency message we talked about recently, if you tell them you're uncomfortable with something, they won't move forward unless you make a recommendation. They're like, okay, that's great. He's uncomfortable. It's like, what do you want me to do? Okay. So know that you have to make a recommendation and then they can move forward. So treatment planning with a purpose is really important. And, your production capability is going to be directly proportional to the number of treatments that you recommend. So, if you're seeing anything north of even 10 new patients a month, you can fill a schedule if you're really treatment planning comprehensively. Let people know what you can offer. And one other little tip is that, sometimes I'll just say, I noticed something. I can't help but noticing that you have some crowding down here. Is that an area that's hard to brush and clean? I can't help but notice that you're missing some teeth in these spaces. Did you know that there's really simple ways to correct that? That is a very powerful way to attack this and just let people know. And so as soon as you start making recommendations, if they care about finding a solution, then you'll find that you recommend something and there's a high chance that they're going to say yes. As you get to where you're really, really competent with this, every treatment dollar that you recommend, by the time the case acceptance for the day plus follow-ups ought to be 85% or higher of everything that you've recommended. So, that's a great lead measure for getting you to the goals that you want to reach. So, hey, be thorough, be communicative, and good luck with making patients happy with the things that you can offer them. See you guys.